Hi everyone, I am Dr. Gunda Srinivas, Pediatric Emergency Specialist at Aster Hospital. I am into General Pediatrics, Child Development and Pediatric Emergency. Welcome to this short talk on autism. So every year on April 2nd, we are observing this World Autism Day. So United Nations every year has a theme. So this year's theme is Advancing Neurodiversity and the UN Sustainable Development Goals. Autism is one of the neurodivergent condition where the child thinks, learns and interacts with the world in a different manner. So here the child's developmental domain, one of the important developmental domain is speech language and socio-communication domain is severely affected. They also have this repetitive behavioral patterns which are very hallmark of this condition of autism, and they have the sensory abnormalities. The way they process the sensory information is at fault. So they have problems with processing sensory stimulus of auditory and touch stimuli. If you see the prevalence of autism over the last couple of decades, it is increasing or it might be more being diagnosed nowadays. So if you see in India currently almost around 1 in 70, 1 in 80 kids are being diagnosed with autism. It comes to around 1 to 2% prevalence. Predominantly 3:1 ratio, so boys are more affected than girls is what we have observed. So autism is actually a spectrum, that's why we call it as autism spectrum disorders, because the symptoms vary from very mild, moderate to severe ones. So the most common symptoms what we see, or the important ones are, as the child develops, you observe that there is a lack of eye contact, lack of speech delay. So by the 1 year of age, the child should be speaking a bisyllable. The child is not speaking by 1 year. By 18 months, there is no meaningful word yet spoken by the child. Then the child has some repetitive behavior in terms of hand flapping, or it can be any kind of behavior which is like very repetitive and not very usual. The child will also have some sensory abnormalities in terms of very sensitive to sound, or the child might prefer very loud sound, or sometimes you might be seeing that the child is creating noises, specific noises on steel utensils, or some noises which is the child likes to have it. You would be observing that the child will be playing with toys in a weird way, that instead of playing with the whole toy, the child might play with certain parts of the toy. For example, like child likes only the wheels of the toy, wheels of the bus or car. This is a pattern it is observed. There is a poor emotional connect with the parents, right? We also one of the most important thing is poor social communication delay. So when the child is there with other kids, they fail to interact with the kids. They always prefer solitary play. They want to be in their own world. There is no specific factor that is known to cause autism. It's mainly some genetic factors. There are some random mutations which can cause autism. Environmental factors are known to cause. So genetic and environmental as a combination are known to cause autism. This is something like there is no specific reason for a person to be left-handed person. Something like that. Bit non-specific, but genetic role is definitely there. So the diagnosis of autistic spectrum disorder (ASD) is mainly on suspicion initially. So for example, the parents might not come with the exact symptoms. They may not have any complaints as such, but on regular visit to a pediatrician, the pediatrician might observe that the child is not making enough eye contact. The child is not interacting in a meaningful way. The child is hyperactive, running around. So this is usually common that in our practice we see that the parents come with the child and the child starts running around in the consultation room. The parents think, okay, the child is hyperactive, but we see that there is no pattern. The child does not make eye contact when we talk to the child. This is very, very important. So one is on suspicion. If the pediatrician has a suspicion that the child might have this condition, that is the first step, that the child needs to be screened. The screening and then next developmental assessment. If the parents have the concerns like all the symptoms, for example, the child is not having conversation properly with the parents, there is no emotional connect, the parents feel the child is always in his or her own world, the child is not playing with the toys properly, or repetitive behavior, sensory symptoms. These symptoms when the parents come up with, yes, definitely it will help us to dig more into the history. So next is the screening. So we have some tools called MChat and Autism Behavior Checklist. These are the screening checklists which the parents can fill up which has a good number of questions which will help us to kind of score them and then give a in detail understanding whether the child is at risk of autism, whether the child will require further developmental assessment in detail. So we have comprehensive developmental assessment tools in detail. So CARS, the Childhood Autism Rating Scale, is one such tool, and there are many other tools which will help us understand in detail about each developmental domain and what are the gaps in the developmental domain to figure out the next therapy plans. So diagnosis is very, very important. So awareness parts a very important role in diagnosis, and the pediatrician also need to be aware that they need to look at these developmental domains, and the aware parent can come back with any of the red flag signs so that the diagnosis becomes early. Treatment of autism is a multidisciplinary way. So initially we need to make sure that the child's hearing capabilities are normal, because here when we say that child has a speech delay, all possibility that if the hearing is not normal, child is not able to understand language and develop speech. So hearing evaluation is very, very important before going for therapy. And there are specific conditions we need genetic evaluation, where for example the child has some condition associated conditions like seizures, hyperactivity and other conditions, where some other evaluation is needed to make sure it's not any specific genetic condition. Once we know that diagnosis stage where we have figured out the gaps based on the developmental assessment, once we have those list of gaps in the child, then we kind of put in therapies. So the mainstay is speech therapy. So here basically the child is told or trained in a manner of how to express themselves. Here the problem is expression. So child is able to understand, but how to express is what is child taught in this speech therapy. Occupational therapy, so the child may not be able to do the simple daily activities of daily living, like simple skills like brushing or holding pen or holding, those kind of skills are taught in occupational therapy. Then we have this applied behavioral analysis, where communication is used to reduce the behaviors which hinder the learning, because the child needs to learn and sometimes there are behaviors which are hindering the learning. So here the communication is used to reduce those behaviors to enhance the learning. So these are the mainstay of therapy, but the overall the child needs to be reassessed frequently. So the developmental pediatrician is the one who leads the whole thing along with other therapists. Are we reaching those goals of this therapy in a frequent, and are the gaps being filled up? It takes time, it takes patience of the parents and the teams to achieve those goals, but it is doable. This is a very interesting part where, as I told, like autism is spectrum. So you have mild, moderate to severe. In one of the category, there is a term called high functioning autism or Asperger's syndrome. Here what happens, the child actually has above average intelligence, but the child is specifically interested in one domain which the child has a keen interest, right? He might be excelling in that field. It might be a painting, it might be literature skills or music. So you would have noted there are famous musicians and scientists who had this kind of issue, but then they excel in that skill. So specifically these children may not have language delay, but they still have social communication delay. They might find difficult to interact with their peers. They might be appearing little bit socially awkward, right? But then they excel. So the key is early intervention. If you are able to diagnose these kids early and then given proper intervention and proper guidance and encouragement in the specific field, they can really excel. Nowadays this is very common what we are seeing, especially because of the excessive screen time. So it can be the screen time might be because of the mobile, laptop, any gadget where the child is hooked onto the screen, and because of the increased screen time and the age of the child. So what we have seen is there is a language delay, right? There is a language delay, there is a lack of social communication domain is not developed in these children, and ultimately what we are seeing is these children who don't have autism but exposed to excessive screen time in their early ages, and they behave like an autism. So that's why it's named as virtual autism. So if we see this the way the child presents, we'll have almost all the symptoms of an autistic child or the autistic spectrum, but when the screen, so the additional risk factor here will be the child will be exposed to too much of screen time, maybe from the age of like less than 1 year or 1 year, 2-3 years, and then the child has all these developmental issues. So here the mainstay of treatment is to remove the screen completely. So once the screen is completely removed and child is supported developmentally, the child actually becomes a normal child, will not have any other symptoms. So this is virtual autism mainly because of excessive screen time.